My name is Abby Vesh. I was in a group with McKenna Koima and Karina Timmermans, and our presentation is about bulimia nervosa. Bulimia nervosa is an eating disorder that can be described by repeating episodes of binge eating. During binges, the individual will rapidly consume a lot of food and kind of in secrecy because they don't want people to know about it. And then this binge is usually followed by self-induced thoughts like guilt and anxiety and fear of gaining or losing weight. And there are two types of variations that come with purging and not purging. Purging individuals will have self-induced vomiting and or ingestions of laxatives, while non-purging individuals, when they binge, that's usually accompanied by excessive exercise or ingestion of stimulants and or fasting. The symptoms for bulimia nervosa include binge eating, purging, changes of weight, and obsessive attitude towards food and weight. And then bulimia nervosa is assessed by looking at the patient's history, a physical examination, and psychosocial examination. When they do an assessment on a patient's history, they're looking for a family history of affective disorders such as depression, and then they also tend to have a long history of dieting and weight issues. And then there are often no, yeah, I think it is it up? Okay, never mind, I got it. It went away, but okay. And then there are often no symptoms noted on the physical examination. However, in patients with chronic vomiting, you may notice parotid swelling, which happens in the patient's cheeks, and it kind of look like they have chipmunk cheeks from all the swelling or from all the vomiting. And then they also have dental discoloration, and then poor abdominal muscles, which is caused from all the vomiting. And then when they do a psychosocial examination, they're looking at just the patient's career goals, their relationships, their self-esteem, and their perception of their body image. And it's important to pay attention to any signs of depression, suicidal ideation, behavior, and then determining the patient's method for coping with anxiety, as well as his or her impulse control is also crucial. There's no set cause for bulimia nervosa, but it is generally attributed to a combination of psychological and genetic issues. One potential cause could be stressful situations, such as it's usually seen in later adolescence life when they're leaving home, such as going to college or living on their own for the first time. Experts found that the stress and depression that comes with this huge lifestyle change can lead to these binge and purge episodes. And then another potential cause is cultural pressures towards being thin. People may just have a negative body image of themselves, which may cause them to have these binge purge episodes. And then they may have poor self-esteem too, and they think that by throwing up their food that'll make them thinner, make them look good. And then most of the time people are involved in activities or even jobs that focus on having a certain appearance that they have to uphold. And then another potential cause could be childhood trauma or abuse that they have faced, whether it's emotional, mental, physical. Those all can be causes to bulimia nervosa. A person with bulimia nervosa tends to have to be officially diagnosed, they need to have 2 binge eating episodes per week for at least 3 months. They can also do a physical examination where they run blood and urine tests that can show if a patient is undernourished or if they have any infection. And then they also do an electrocardiogram to identify any problems that would happen with the heart. For a psychosocial evaluation, again, they look at their career goals, their relationships, their self-esteem, their body image, how they think of themselves, and then they also look for signs of anxiety and depression, which is a huge trigger for bulimia nervosa. When it comes to treatment for this disease, they can do a cognitive behavioral therapy, which addresses dysfunctional emotions and behaviors and helps to normalize the patient's eating patterns. They also can do medications, and a huge one that they do is antidepressants, which may help decrease binge eating and body weight concerns. They can also do a team approach where you can work with an interdisciplinary team, which helps coordinate efforts just to help the patients and learn their habits. And then the huge treatment that they do for bulimia nervosa is nutrition education, and this is an eating plan made by a dietitian for the patient, just to help them achieve healthy eating habits, make sure they're eating the right types of food and ones that the patient isn't comfortable with. Oh, sorry. Alright, And then in some cases, hospitalization is necessary. That's only in the severest of cases. It's not super common. Usually they're able to treat it just with a lot of like counseling and talking through with different healthcare professionals. And then statistics show that approximately half of all persons with bulimia will fully recover. 30% will have a partial recovery, and then 10 to 20% will still battle continual symptoms. It's important to follow up with their nutrition. When you look at their nutrition, you want to look at their diet planning and their food intake. You want to look at their frequency and duration of binge purge episodes. And it's also important to look at their volume depletion just to maintain a healthy weight all the time, make sure there's no huge fluctuations with that. And then just to look to see how they're responding to care and teaching. It's really important for bulimics to understand the disease that they're battling and to have and to know that they can reach out for help and that there is ways to help them. And then just to not even give them a form of treatment and like dieting and things like that, but also mentally. So understanding, helping them understand ways to cope and battle with this bulimia nervosa. And that is all.